That's it. So now she's completely blocked here. In a few minutes, when I start doing the tumescent, she won't have any pain. Yeah, let's do that. We want to be deep. Okay? Does she feel any?
Just feel your motions on the neck.
Yeah, that will go away.
Oh.
Sorry. That's it.
O da acı ağrı falan değil yani o enjeksiyon hissi.
Just ask her not to talk. Bring her neck back. Don't talk. And bring your neck back. Head back. There you go.
Kafanızı geri alın, tamam.
Omuz altına havlu mu koysak acaba?
Şu başın altına gideceksek yine.
Evet, omuzun altına.
Aşı çukur mu?
That's it.
Boyun ağrıması.
So now I'm at 60 and that'll be it.
Çok güzel, şu kadarcık bir şey var havlu. Rahat etsin kafası.
This is, you can do standard tumescent, which is 1,000 milligrams in a liter. I do double for the face. I do 2,000 in a liter. So 1,500 mils. Okay, now this is important. For the jaw, when you want to be close to the jawline, this is the only area where I actually go very superficial. See that? Very superficial here.
Why are you trying to start this show?
Because I want to try to separate the skin from the nerve as much as possible to keep the nerve safe. Only in this area. Okay? You see, this is the only area where I go superficial. To create space for the nerve. This is a technique I was taught by Salvatore Pagano. He's my friend.
We call it hydroseparation.
Hydroseparation. I call it Pagano. Yeah, Pagano technique. So I'd like to do a little bit more. See? Hydrodissection or hydroseparation. That's it. And then like that. And a little bit more and we're done. How do you say pain in Turkish?
Ağrı.
Ağrı?
Yeah.
Ağrı.
Ağrı? No. And how do you say no?
Hayır.
Higher. Higher ağrı. Correct?
Yes.
Ela in Arabic, you know.
She speaks Arabic?
Maybe she understands Arabic.
تحكي عربي?
No.
خلاص, that's it. Done. So now we wait. Do you have tape?
Bant var mı?
Şimdi kalp atışım hızlandı.
Evet.
18 gauge needle. No need for scalpel.
Elden nasıl yapmışlar? İleride kullanıyor.
Bunları
There. So a little bit undermining, not too much, just to make sure there's nothing stopping. And then when you get close to the jaw, very superficial. Okay? We begin. No. Neck back. Don't move, please.
usual speed you
Yeah.
will be throwing.
Yes.
So are you counting something?
Nope. I'm looking always at the number of pulses.
How superficial should we be in this area?
Like that. You have to leave about 1 centimeter.
Dr. Panel, sometimes we see red.
Yeah, that's
what?
normal. It's safety.
Safety. So
Like now. It means it didn't feel anything, so it didn't fire.
Okay.
It's very safe.
And if it's overheated, it automatically stops.
Yeah, which is what happened there. See? Safety.
Safety. Maximum the dosage will be like.
I'm already at 77, which is what I was expecting to be at 80 for each side.
Okay.
So I'm almost done. Done. So just here, because I'm not really heating a lot here, I'll just come in a little bit like that. You see that? And I'll stamp twice.
Does it mean it is too hot in?
No, it just means it's not touching it. Good.
And according to the
Done.
old device, it doesn't show the temperature, right?
No, you don't need temperature control when you have impedance control.
Okay.
So here, impedance, very short pulse. That's your safety. So 92, a little bit over. I don't care. Next side. Okay.
Evet.
Neck back, like that. Tell her to push her neck back.
Biraz daha boynunu geriye doğru alır
There you
mısın?
go. That's it. Almost done. Just 2 minutes.
Bu pozisyonu koru lütfen. Ağrı falan hissediyor musun? Hücreler falan var ya, ondan dolayı.
You can actually still feel this part hot a little. Here. Sorry. What's my number of pulses?
Pulses is
168, 69. 170.
Ooh, dropped the pad. Sorry, I dropped the pad on the floor. Here,
It's going to be more superficial.
very superficial. Yeah, that's fine. She's doing well. I'm not seeing any issues. But just a little bit here.
Is this a small nodule or something like that when you fire the shot?
No. Where? No. Zero nodules.
Okay.
Trying to make you look bad?
Oh no, popcorn effect I think.
Yeah, a little popcorn effect. That usually goes away in 24 hours. But I don't see a nodule, like maybe just a little popcorn. So I'm just stamping here a little bit.
200.
Yeah, that's it. That's what I was expecting. 190 to 200. but I still feel a little bit of fullness there. So I'll just go back and do a bit more. It's a very visual treatment, so if you need to go over a little bit, it's okay. Okay, done. She's bleeding a little bit from the skin here. So I stopped the bleeding a little bit.
Dr. Fadi, for example, we had the previous device which we were using in the eyelids.
Acutite.
Acutite.
You need to still use the acutite. We're now looking into making an even thinner one.
Oh, yeah.
We're looking into it. Could I have nothing? I don't need anything. Wow, so strong. I can't even. So this is what I mean by fat extraction.
Burada inflamasyon artıran en çok yağ asitleri oluyor abi. Onu bir ortamdan uzaklaştırırsa.
That's it. And then
Doktora bıraktın mı?
Yok abi bitirdim.
Bitirdin mi? Ben de bu ay bitiriyorum.
get your hands wet. Hello.
Çok uzun zaman oluyor. Yani.
Evet.
It's gonna get dirty here, so. This is my famous massage. Good. Okay. Everything is out now. All the oils and we're done. No need.
Nasıl
Sen
olsa
patron
Fatih.
kompresi getirsene.
Neck back.
Boynumuzu geri alalım.
No, don't taste the blood. But just.
Tamam.
I want to do the face. I make access point from here.
But she don't need.
In her case, no, because she doesn't have a lot of fat.
Okay.
I don't want to mess with her fat here and make her thinner before knowing the patient, and you know,
Okay.
because I don't really know her that well. But if this is something I had discussed with her and she said, yes, I want this reduced, you just make small access point from here. And this fits very easily here. You can even go from here all the way to the neck and do a little bit above the sternocleidomastoid because you can get some more of that. Okay. And you can heat here, no problem. See, because I'm in front of the mesenteric tuberosity. So no problem at all.
And in this point, we have to be superficial or
Very superficial and not more than 6 centimeters below so you don't hit the nerve.
Okay.
This is bad Vaseline.
Ben.
Kalkıyor çıkıyor.
Asetonla alkolle çıkar onlar.
Acetone definitely
We can
removes it.
handle it.
She can handle it.
Yeah.
Acetone removes it.
Yes.
No, this is not the question of Vaseline. It's the marker is so good. Acetone removes it. You're right. But I want to just try a different experiment. No, I always do Morpheus immediately after. I'm happy to do it now if you want. We didn't really discuss it with Sarkan, but I can. Sarkan, can I? So you have to hear it. Did you hear? Okay. So 24 pins. I have 3 bones. Cycle. This is cycle.
You don't use the burst.
I do. Per contraction. Okay? Alright. Let's say this. I this. Or slower. So I'm pressing, the needles are in the same position, and I'm stacking one pulse on top of the other, and it's a long pulse. So this to melt fat. So here, jowls, along the jawline if you have a thick patient. So I divide the patients thick, medium, and thin. So thick patients, you can go from corner of the mouth all the way to here and under the submandible with this mode. Thin patients, you don't want to do this. You're going to melt their fat. So for thin patients, you want to do cycle mode. But in her case, she's very thin here, but she's medium here. This is medium depth. So when I want to do medium depth contraction, yes, I can go to cycle, and I can do 4 and then 2 to try to get the FSN to contract. Or I can now go to burst. 4, 2. But if I choose burst, because I'm choosing 2 as my lowest depth, look, my energy is limited to 20. I can't go more. I'm stuck. I want higher energy on 4 because I want to deliver more energy on 4. So I can go to scale. When I choose scale, I can go up on the energy. Why? Because scale automatically delivers 40 at 4 and 70% less at 2. Whereas if I go to burst, it's going to deliver 20, 20. So it won't allow you to go higher than 20. You're limited by the most superficial depth. But if I go to scale, I can go to 40 and 2. Why would I want that? Because at 4, here 40 is not dangerous. She's not thin. See that? Okay.
In every noise, it makes 2 shots, right? Right now.
In her case, because I want to contract, not melt fat, I'm using burst. Burst is a contraction mode because it's 2 cycles, one on top of the other. It's a cycle at 4 and a cycle at 2 in the same shot. So you don't have to waste time going 4 and then 2. But it's only a cycle mode in the sense that it's a contraction mode. It doesn't melt fat, so you can use millimeters, not 4. So you see, guys, I'm just doing contraction here. $40 at 4, and then I think 12 at 2.
I guess you don't have local there, but is good. So it's.
I have enough local from what I did earlier.
It was split.
Yeah, because I went here, remember?
Oh yeah.
So now she's feeling a little bit here because this is a blind spot. And she'll feel a little bit there. Also very common to get some muscle twitches because this is the 3D tip. There will be a software update coming out in the next 2 weeks where this will go away. They'll reintroduce the delay. There used to be a delay when the needles went in. There was like a short microsecond delay before the RF was delivered. They took that away. But we told them to put it back, so they're putting it back. So 4 and 2 FSN contraction because the pulse is so short. You can't melt fat with this. If I wanted to melt fat, let's say here, what would I do? 4 millimeters at 40 fixed, and I would stack 1, 2, 3 on top of each other.
Do you consider to go
Sorry.
even deeper in some
Yeah,
patients?
hell yeah, I go to 5. You can go to 5 now on the new one.
What about for example 7?
Yeah, I don't do that anymore, but in some patients who have huge necks,
Or
yes.
maybe very deep nozzle level, something like that tissue.
You'd
It's
have
very
to.
thick.
I've never seen the need to go to 7 in the face. To be honest, I've always done maximum 5. but I believe that in the body, you definitely go to 7. In the face, 5 has been enough for me. But if you feel that the thickness is so big, go. Deep is not dangerous, unless you're working here.
Yes.
You don't want to mess around with deep there. That's it. We're good.
So you do overpasses over this?
I only do, with this, it's a single pass for her, but if I've missed some spots, I'll go over them. But I haven't really, I think she's good. That's it. Super easy, super fast. Well, easy for me. It was a little bit harder for you.
Daha